And with that, I'm going to turn it over to get our panel started. Um, Turn it over to our moderator for the session. Fallon Petros is skilled at health promotion, education, and community relations. Fallon has a passion for health equity and social marketing. Prior to joining Cura, Fallon worked at Child Care Aware of America to support childcare resources and referral agencies across the country. Fallon's professional experiences also include serving as a health educator in Innova Health Systems. Fallon received her Master's of Science and Public Health Education and Promotion from Marymount University. Welcome to the stage, Fallon.
Thank you. I am so happy to be here. I don't want to take up any more time. I'm going to jump right in and actually introduce our first presenter, which you see on screen, Sunil Iyengar. Sunil directs the Office of Research and Analysis at the National Endowment for the Arts. Under his leadership, the office has produced dozens of research reports, hosted periodic research events and webinars, and established the research and data partnerships with the U.S. Census Bureau and the Bureau of Economic Analysis. His office also leads strategic planning, program evaluations, and performance measurement for the agency. Sunil, over to you.
Thank you very much, Fallon. And it's really a great pleasure to be here for me and a learning experience as well. I will note that we haven't, this presentation that I'm going to give isn't explicitly about health literacy, but I think hopefully it'll provide some resources and point to some directions that may be very beneficial for people here. I'm certainly learning a lot, and I'm again grateful to Diana for having invited me. So I'm going to just, if we can go to the next slide. I'm just going to, pulling up something here. I wanted to just tell people a little bit about the National Endowment for the Arts so they're aware of what, where I come from, essentially. So the NEA is a relatively small, independent federal agency in the government, and our goals are really to advance equitable opportunities for arts participation and practice. We foster and sustain an environment in which the arts benefit everyone in the U.S. Our primary activities include grant making to nonprofit arts organizations, public arts agencies and other organizations, and individual writers and translators. Our funding is appropriated by Congress annually, and across all of our programs, we directly award over 2,000 grants each year that support our mission and goals to organizations of all sizes across the U.S., including all 50 states and 6 U.S. territories. But we also, what people may not realize is we do have a direct connection to health. That is to say, in our strategic plan, one of our goals is to integrate the arts with strategies that promote the well-being and resilience of people and communities. And that then breaks down into 2 objectives, one of which is to support arts projects with a focus on advancing the health and well-being of individuals. And another has to do with embedding the arts in system-wide initiatives that strengthen or heal communities. So there's a lot of great work that gets done through our normal grant making. What I'm talking to you about today, though, is from our research lens. And I'll just say that, fortunately, you're not going to be seeing a lot of tables and graphs. I could spend all day on that, showing some terrific associations between the arts and health benefits. Rather, what I'll be talking to you about are some resources and programs, but it will be a whirlwind tour. So I'll be going very fast, and Diana's helping me out, co-piloting. So thanks on the slides. Next slide, please. So one of the things that maybe be a good way of framing this is just a couple of weeks ago, you may have seen, and I'm sure this was discussed earlier, the Surgeon General released an advisory on what he called an epidemic of loneliness and isolation. The report itself shows strong correlation with loneliness and conditions like heart disease, stroke, dementia, and even premature death. And it goes on to recommend a lot of community assets and infrastructure, which we can also include the arts in, as really beneficial in improving the odds of positive health benefits for individuals who are facing loneliness. And I say that because the arts has been shown, and this is where I would have pulled out some graphs and tables, shown some strong benefits when it comes to things like socialization, interactivity, a lot of both psychological and physiological benefits associated with arts participation. And for example, 82% of adults, according to our surveys we conducted with the Census Bureau, 82% of adults who went to an arts activity in the previous year did so with family or friends. It's often seen as the top reason for going or engaging with the arts is the social aspect of it. And conversely, those who don't participate in the arts often will cite lack of someone to go with or to be with in doing that activity. So I think that, and we also know that the arts are highly correlated with community engagement activities such as volunteering. So this is all to say that I think this report actually sets up kind of a problem statement that I think the arts are there to help solve. Next slide, please. So a few years ago, the NEA partnered with the Department of Health and Human Services and a variety of other federal agencies and departments, about 17 or so, to set up something that we call the Interagency Task Force on the Arts and Human Development. We meet every quarter, share best practices. This does get into health communications as well about the arts and how they can be integrated in the missions of other agencies, particularly to ensure positive outcomes across the lifespan for the nation. And all of these slides come with a little web link, so you can go and explore this more on your own. Next slide, please. And we have a lot of resources that have been generated by this task force, including a variety of research publications and even some co-sponsored workshops and funding opportunities. But in this case, I wanted to draw attention to a couple of reports in particular that are on the last two reports here. One is a guide for conducting research in arts and health that involve community engagement. So community engagement through the arts and how that can be a lever for better research on arts and health. And another one having to do with arts and the opioid crisis, where we looked at pain management and outcomes related to substance abuse prevention. So these are two reports, but there's a variety of these kinds of research-based reports that have been generated through this task force. Next slide, please. I also wanted to tell you, so you're aware, that this is not just the NEA. There seems to be a broader cross-government approach to integrating arts and culture in various areas to improve broader, what we call recovery and resilience. So that term recovery here is definitely a call back to the onset of the coronavirus and the fact that when COVID broke, a lot of federal agencies were left kind of wondering, how do we create a system where this kind of thing, any emergencies are kind of, there's a better infrastructure for coping with that, both at the national and in the community level. And here, a lot of emphasis was placed on psychological factors having to do with resilience and well-being. So this is just a model of something that has been formed by a working group called, it's a group related to equitable long-term recovery and resilience. And if you open this link and look at various reports, you will see that, if you look at the main report, you'll see that arts and culture is consistently integrated with a lot of these strategies and a lot of these assets, whether we're talking about basic needs for health and safety, lifelong learning, reliable transportation, or a thriving natural world. All these elements, there are places in this report where the arts directly intersect with them. And it even makes policy recommendations that go so far as to call for better integration of arts across federal agencies in seeking to improve recovery and resilience. And I should just say this particular model here is from, some of you may know, the Vital Conditions Framework for sustainability and for thriving communities. So there's a lot in there to just give you a sense of how other federal agencies are starting to converge on the value of arts and culture in promoting health outcomes. Next slide, please. And there was also another kind of top-down thing. The President Biden had an executive order last year where he talks about cultural vitality and particularly the role of arts, humanities, museums, and libraries. And in this executive order, he really invites or challenges other federal agencies to start working more with the NEA and other federal agencies in arts and health to in arts and culture, to try to integrate arts with their missions more effectively, and particularly around things like social and civic well-being and quality of life. So I wanted to draw your attention to that presidential executive order, and also showcasing the work of our chair, Dr. Maria Rosario Jackson, who herself came from a background, in addition to academia and as a researcher, coming from community planning, comprehensive community planning and urban development. And she spent a career really trying to find ways to integrate the arts and bring artists and designers into conversations with community planners. And she's done a lot to kind of advance knowledge about the arts and public health. And so I think it was really of a piece with what the executive order is kind of calling on agencies to do. Next slide, please. So one good example of how this works in real time is, and we're going to be hearing from Dr. Sankey, who herself was very involved with vaccine efforts, readiness efforts at the Centers for Disease Control and Prevention. But CDC worked with the NEA as well as the CDC Foundation, and to promote through arts, really using arts and having artists work to promote the concept of vaccine competence, and not initially for COVID, but presumably for other vaccines down the road. And so they funded 30 organizations, the CDC Foundation did, with support from the NEA and CDC in 18 states. And these organizations in rural and urban communities supported art mediums such as film, theater, videos, street art even, crafts, podcasts, all kinds of ways to promote, very innovative ways to promote and really get people to understand the value of vaccination through the arts. And so this is a good example of the arts coming to bear on health literacy. Next slide, please. And it culminated in an exhibit that's at the CDC Museum right now in Atlanta. And our chair went down there recently to visit and to promote it. And I encourage you to take a look at it if you are in Atlanta, and there may be some resources online, I think, at CDC's museum as well. Next slide. So how do we continue to kind of raise awareness? Well, some of it is through these intergovernmental efforts at the federal level, through supporting grants that do these programs and interventions. But we also need better research. And we've, for years now, run a couple of different research grant programs that we're always trying to get the word out about. Because when you think of the NEA, you may hopefully think of arts in action in your communities, but we also wanted you to be aware that the arts support knowledge development and research. So we have two grant opportunities, research grants in the arts, as well as NEA Research Labs. The NEA Research Labs is more of a sustainable multi-year research program that is conducted by various organizations around the country. Research grants in the arts are for one-off studies on particular topics. And many of these, as you'll see, are about arts and health. Next slide. So I'm going to just also say that we came up with a new research agenda a couple of years ago that's guiding a lot of our work and is guiding our grant announcements and our application guidelines. And you can click through this rapidly. It's one of those pop-up animation kind of slides. The questions of relevance here, I think, to this group are, if you're interested in knowing more about funding opportunities for research at the NEA, we are very, very interested in measurable impacts of the arts on individual health and wellness. We also are very interested in understanding how communities benefit from health. So both for individuals and for communities. And when we say for communities, that extends not only to public health benefits, but also, kind of collective action kind of benefits, collective impacts that may result from arts education or other ways the arts are integrated in communities, but essentially for the healing and revitalization of communities. So we're always open to research proposals in those areas. Next slide. And I'm just going to really rapidly, probably won't be able to go into each of these, but just to give you a snapshot, if you're just kind of skimming these little project descriptions, these are essentially brief project descriptions of grants. Some of the grants we're now supporting at that intersection of arts and health. They range from things like theater to advance outcomes for youth with anxiety and depression, to musical performances in ICU. Next slide. Here's some others. And I should say, as you look at these, we do very much cover different areas of the lifespan. So you have children and older adults reflected in our work. Next slide. We also are doing a lot of work around mental health in the arts, and this is again coming from our applicants who come to the NEA for research grants. These are some of the successful ones in the area of arts and health. Next slide, please. Keep going. Just giving people a sense of what we have. We also have these research labs I mentioned, which are more kind of long-term endeavors where we really foster transdisciplinary research. That is to say, more than one or two research disciplines reflected in the work, but also working with arts organizations, typically nonprofit arts organizations. So one at Drexel University looking at post-traumatic stress and traumatic brain injury, but also looking at post-surgical pain management, opioid usage, and how the arts, particularly creative arts therapies, can help. Next slide. One in Denver we're really proud of is looking at sort of caring for the caregiver, research about particularly critical care providers and how creative arts therapies can build resilience for that population. Next slide. This one I won't go over because I know Jill will talk about it, but it's the lab we're privileged to fund at University of Florida. Next slide. And I'm going to end by talking about a few things that we're involved with, which I want you to be aware of. One is the Sound Health Initiative. That's Renee Fleming, the soprano, with the former director of the National Institutes of Health, Francis Collins, himself a musician, in addition to being a world-famous geneticist. And they got together with us and the Kennedy Center and also the Kennedy Center to create a movement around music and health, and particularly music neuroscience and health. Next slide. That actually resulted in funding opportunities and a peer-reviewed article, but also funding opportunities across NIH for music and health in particular, and the NEA is co-supporting those opportunities. Next slide. And then what we did is we at the NEA partnered with University of California, San Francisco to create an online national clearinghouse or research resource called Sound Health Network. Next slide. And these are some of the team members on that network. And I urge you to go check it out sometime. These are researchers in their own right, many of them. They're also people who are very interested in health communications as it relates to the arts. Indre Viscontis is very much in that category. Charles Lim is a researcher on creativity in the brain. Julian Johnson studies geriatric nursing and the arts. And Sherry Robb looks at music therapy. Next slide. But the point is, it has a whole bunch of resources. Here's the web link. It's a virtual networking platform for people interested in music and health. Next slide. And we can just skip through some of these. They just showed you that we also share research funding opportunities and other things through this website. I want to end with a few more things to note that we also work with the Departments of Defense and Veterans Affairs on a program called Creative Forces, which is all about, I mentioned creative arts therapies, that's music, visual arts, dance therapies, particularly in military connected populations. And so in studying that, in offering those interventions, we also do rigorous research and evaluation. Next slide. We're currently in 12 places around the country. You can go to the next slide, sorry. It's part of an integrated healthcare team across 12 different sites, including a telehealth site where we're studying these interventions as they occur in real time. And we also, at the next slide, offer now community engagement components. So this is another grant opportunity for folks if they're interested in offering health interventions that involve the arts for populations that are connected with military bases, but this may be off-site as well. Next. And that's it for the NEA, but I wanted just you to be aware, and I'm just going to flash these slides and I'm at time, but to show you that there are some other opportunities out there that the NEA have been involved with, but that are not our own principally. And I'll just end with this one, which I think is really important, the work you do. And I know Jill was involved in this work, Dr. Sankey, has to do with We Making, which is a report that we commissioned with several other foundations on how arts and culture unite people to work toward community well-being. A lot of it has to do with health literacy as well. I urge you to look it up. And please, if you have any questions, put them in the chat or however we're doing this. And I look forward to hearing the questions later. Thank you so much for your time.
Thank you so much, Sunil. And as a reminder, please, please, please add your questions into the chat. We'll be sure to take the time to review during our Q&A portion today. I will now introduce our two presenters. So I will start with Miss Jessica Burke. Jessica Burke, PhD, MHS, is Vice Dean and Professor in the Department of Behavioral and Community Health Services at the University of Pittsburgh School of Public Health. She is passionate about using engaged, creative, and systems-oriented methods to address determinants of health and methods that include visual components that facilitate dialogue and action. Her background is in anthropology, social epidemiology, and health promotion, and her early work in health includes serving as developer for the Changing Face of Women's Health exhibit at the National Museum of Health and Medicine. Jessica's scholarship uses innovative, quantitative, and qualitative methods to explore systems and the mechanisms linking context influences in health, engages communities in the process of research and its transition, and develops tailored interventions. The book, Methods for Community Public Health Research, Integrated and Engaged Approaches, that she co-edited, provides details about this agenda. Additionally, we have Sarah Bowman, which is a public health mixed methods researcher with primary research interests in participatory, arts-based, and visual research methods, women's and adolescent reproductive health, and mental health. She has over 14 years of experience conducting research and programming in health and development in South Asia, with a current focus on Nepal. Her research agenda embraces community-engaged methods and developing evidence-based approaches for improving social determinants of health. Her research has been published in peer-reviewed journals, including Qualitative Health Research, Global Public Health, Health Promotion Practice, Women's Reproductive Health, and more. Her work has been featured in diverse media outlets from NPR to Glamour magazine, and her films have been screened at the Smithsonian Institute, Cooper Hewitt National Design Museum, and United Nations headquarters in New York. Sarah's work has been supported by a Fulbright scholarship to Bangladesh and a Boren fellowship to Nepal. I will now turn it over to these two presenters to share a little bit more about their work. Thank you.
Thank you so much for those great introductions. I'm really excited to be here. I'm Jessie Burke, and I am from the School of Public Health. And we are really excited to be here to examine creativity, engagements, art, health literacy, and all the things we love, and to talk about collaborative filmmaking, a method that Sarah and I co-developed, and to talk more about this intersection between health and the arts. So thank you, Diana, for the invitation to be a part of this amazing panel. Thank you, Sunil, for providing such a wonderful overview about the importance of arts for public health and for really setting us up to provide our specific example, which focuses on film. Next slide, please. So today we're going to provide a very quick overview of the visual, participatory, and arts-based methods called collaborative filmmaking. We're going to provide two examples of how we've used this method around the globe to address sensitive health topics. In this case, we're going to focus on menstruation and on mental health. And then we'll comment on how the method is really a creative tool for understanding complex topics, for intervening to improve individual and community health, and for engaging diverse stakeholders. And we'll wrap up by summarizing the benefits of integrating collaborative filmmaking into health initiatives and by exploring the link between the method and health literacy. Sarah and I are truly a team, and so we're going to co-present here. We'll bounce back and forth in terms of our presentation. Next slide, please. So before we get started, we do want to say thank you to the amazing filmmakers who participated in all of our projects. Again, we're just sharing two here today. but we really appreciate that they have trusted us with their stories and participated in the projects. We also want to thank all the students who support this work. Their passion and creativity are truly inspirational, so thank you. Next slide. In terms of positionality, as I mentioned, my name is Jessie Burke. I'm a cisgender white woman. I was born in and raised largely in the United States, but I did live in Thailand from the age of 6 till 12 years old. My dad is an infectious disease researcher. We were there for his work in tropical infectious diseases. And I returned to Thailand in my mid-20s to do my graduate training in HIV work among women in northern Thailand. And it was really those experiences and my training in cultural anthropology, epidemiology, and public health that drive my community engaged focus. I'm also very much a visual learner. I need to see things to understand them. And I believe that storytelling and visuals are key tools to these efforts. Sarah, do you want to introduce yourself?
Yes, thanks, Jessie. I am showing up today as a cisgender white woman, also born and raised in the US. Spent most of my childhood in the US, but moved to South Asia after my undergraduate studies. I had the fortunate opportunity to spend around 10 years living and working full-time in several countries throughout South and Southeast Asia, but most recently focus on Nepal. While I am not of Nepali origin, I care deeply about health and gender and equity issues in the region and have spent the past 8 years studying Nepali context, culture, and language. I adopt a transformative paradigm in my research, so I aim to center community voices in my projects that promote social change. And finally, I bring a background in documentary film production to this work. So I'm very passionate about this intersection of the arts and public health and harnessing the power of storytelling and visual and creative methods in my research, advocacy, and intervention work.
Thanks, Sarah. Next slide, please. So storytelling is really central to being human, and film has the power to incorporate critical elements of storytelling and to combine them with visuals. And so we can share experiences, opinions, messages. And we developed collaborative filmmaking, largely led by Sarah, in 2018, based on our belief that visual film-based participatory research could help us to gain a depth of understanding around sensitive health topics. And you'll see in the example, we piloted that to address menstrual health experiences in Nepal. And this was part of Sarah's dissertation research. As she mentioned, she has a background in film production and documentary filmmaking, as well as global health. That combined with my prior work in arts-based methods, as well as community engaged work, really led to the development of collaborative filmmaking. And it was built on our understanding of how filmmaking methods have been used to explore a range of health issues. Like good academics, we went ahead and did a nice literature review to see what had been done in the past and built from there. And our experience using community-based participatory research and previous work in the visual research methods laid the foundation. Next slide, please. I wish we could spend a long time talking about it, but I'm just going to provide an overview. Collaborative filmmaking is a research method. It includes 6 steps. The method trains participants as filmmakers and collaborators, and that's from the initial generation of ideas to answer a research question through data collection, analysis, and dissemination. The activities and the timing can be adjusted depending on the specific research questions and populations. In step 1, participants are introduced to collaborative filmmaking, the research question, the project focus, and basic filmmaking and storyboard development through interactive hands-on workshops. After the training, participants go out with cameras to create their films. Next, the research team assembles the clips into one film file per participant in preparation for co-analysis sessions. And while reviewing the films, the researchers create a list of clarifying questions, probes, and issues that we want to explore in greater detail with the participants. For the individual co-analysis sessions, each participant meets with a facilitator from the research team for a screening of their film. So to look at their film and to talk about it in much more depth. And these are really key for providing context and contextual information directly from the participants and for clarifying actions, dialogues, and behaviors seen in the film. And we can talk more about that in some of the examples. Next, all of the participants are invited to a group screening of the films and a group discussion where it explores the variety of perspectives that have been explored through the films as they relate to the research question and to really develop some group consensus. Once the films are finalized, each participant is asked if they want to have their footage included in a final film. And for those who wish to have their films screened publicly, a community screening is organized in which participants are given creative control. So we work directly with them to figure out how should we screen it, where should we screen it, who should we invite, and what kind of activities they want to conduct. And then the final step is really the synthesis of the data. So collaborative filmmaking as a process results in a range of data types, including participant films, the audio recordings from the individual co-analysis, from the group discussions, field notes, et cetera. And we can use all of that to address the research questions and the aims of the project. So that gives you an overview. It's a systematic set of steps, again, designed based on existing work as well as our experience. And Sarah's now going to share a little bit about the pilot project where we first used this method in Nepal. Next slide, please.
Thanks, Jessie. So by now, you know, we're community engaged researchers. So we thought the best thing to do after coming up with this idea based on what we found in the literature was to take it out and actually pilot it. So we ended up piloting our idea where I had ongoing work in Nepal to really gather reactions and responses to this idea of using film as a research tool. So we piloted this approach with a group of girls between 16 and 18 to explore traditional menstrual practices that they followed in their families, as we knew that these were having impacts on health, both physical and mental health in far west Nepal. And one particular area of interest was this practice called chaupadi, or the tradition of menstrual seclusion, and how this cultural practice impacts day-to-day life. And so we thought filmmaking could be an interesting way to explore this. And so I'd like to show you a brief trailer from some of the films created by the participants in the community, and it will hopefully give you a better sense of what the method and the products look like, which is very powerful and much more powerful than me talking about them. So next slide, the video should go ahead and start. I'm not able to hear the sound on my end. Next slide. Great. So all the footage that you just saw there was just little pieces of the films created by the participants and really only a glimpse of what they created. So I will leave you with the website at the end of the presentation if you would like to watch the full films, which I encourage you to do so. But what did we glean from actually piloting collaborative filmmaking in Nepal? Well, we found that overall collaborative filmmaking offers opportunity for research, intervention, and advocacy. So first, it is worth mentioning that we originally designed collaborative filmmaking as a research tool. So one that would be systematic and ideally help us uncover nuances and complexities as a rich qualitative tool. And what we found that it helped us to uncover motivations and differences between families in one village alone. It helped us uncover details that had not come up in previous interviews that we had done with participants. And these were all demonstrated through these rich and powerful films. So our first hypothesis was right that, these films were extremely powerful and engaging. But beyond a research tool alone, we actually found that collaborative filmmaking also offers opportunities as an intervention. In fact, we've been able to keep in touch with participants over the years since completing the project in 2017. And one shared that the project actually increased her confidence and communication skills. She said, "Nowadays, I don't feel nervous to talk with anyone." And that was 1 year after the study. So we began to see that these are benefits that extend beyond just the addressing the research question alone, and we're now thinking about ways that we can incorporate film as an intervention tool. We also discovered that collaborative filmmaking offers a unique way to engage the broader community in dialogue as an advocacy tool. For instance, one participant talked about the power that they've seen change in their communities among their friends and adolescent girls through using film. Over to you, Jessie.
Great. Next slide, please. So we thought it would be helpful to show another example of how we've used this. And after we had done the work in Nepal, we were really inspired to explore other topics, other contexts, other communities. And we started working in Pittsburgh with high school students to explore the stressors and supports in their life, and to do so using collaborative filmmaking. So this project started in February of 2020. We all know what happened then. We had to make a quick pivot to incorporate COVID and the pandemic into the project. And that meant that we had to change how we went about doing the sessions, as well as making sure that we were addressing it in our research aims as well. And it was amazing how the participants were able to come up with creative ways to express themselves using film. And so that include the traditional sort of approach to more of a documentary style that you saw in the previous example, but it also included things like they taught themselves animation, and they used that in the films as well. So the results of this project were recently published in the journal Health Promotion Practice. So I encourage you to take a look at that if you're interested. And Sarah and I recently discussed the project on their associated podcast, and where we talk about this as well as some of our other work in arts and creativity. Next slide, please. So here is one clip from a participant's film. Again, this will give you an example of what they created. And this is from a film that she called Chasing Happiness. If you could play the clip, please.
I am someone who can recognize that I have something and you have something that no one else does. And that is that I am someone and you are someone that no one else can ever be. I can say with complete clarity and confidence that I would be nowhere without my experiences. Don't let challenge break you, let it build you. Of course, it is much easier said than done. I would never want to minimize or dismiss the heavy challenges that youth in our day are dealing with. To those who are struggling, I hear you and I see you. I've been there. And what I've learned is that there are many, many things that can help make your journey a little less painful. Seeking help is one of the strongest and most effective things a person can do.
All right, I think we cut the clip there. I would love to see more of it, but we're running out of time. So I just gonna hit on some of the highlights in terms of, again, how we started this method and developed this method as a research tool, but really have now seen the impact that it can have on intervening at the individual level and community level, as well as for advocacy. And so this project in particular contributed to the growing research on teen mental health, particularly during COVID. And so from these films and the work that we did with participants, we learned that though the pandemic took a toll on their mental health, they talked about it is actually not such a bad thing for many of them, that it was a chance during quarantine and the stay-at-home orders where they were able to surround themselves with the close friends that they wanted to, and they could avoid people that they were less comfortable with. They felt less stress and pressure associated with socializing with entire groups, and they had personal time to clear their heads, is what they talked about. We also learned from a participant who said that they really hoped that the films could be used to help other teens, and that they could relate to them and feel they're not alone in the struggle, because there are many people out there who are dealing with similar things and should be empowered to reach out for help. And then finally, a quote from one of our partners for this project, who's working on a behavioral health initiative for Pittsburgh youth. This quote really highlights how collaborative filmmaking is a unique way to engage teens, and comments on the vulnerability and creativity demonstrated in their films. And as I mentioned, these films are screened. And in this case, it was with school administrators, community leaders, and parents. And that really helped them to gain a better understanding of the daily stressors that the teens were experiencing. So I'm now going to ask Sarah to wrap us up here with a discussion of the strengths and challenges associated with the method, as well as sort of how this connects with the focus of this conference.
Thanks. So we both love this method. That is clear. It's taught us a lot about our research topics, and also shown us that there can be kind of these unintended benefits from using the arts in exploring public health topics. But there are also some challenges to think about. And the first challenge, particularly around ethical considerations, is one that we do address in the filmmaking workshop, around kind of making sure that the participants are trained in a background in ethics before going out and making these films. But as you can imagine, it can be challenging to collect visual and identifiable data and the associated consent process. And so all of these ethical considerations and comfort levels must be carefully considered and negotiated with your particular topic and community. We could talk about this all day. It's very complex, but in this particular project, we treated consent as an ongoing process where footage could be removed or added at any point in time throughout that process. So really the storytelling process was held with that filmmaker and that filmmaker alone. And they were not, it wasn't guaranteed that they would have to share their films publicly. They could decide if they wanted to keep it a private film as well. It's also time intensive. You can imagine and see how much data that we have been able to collect through this process. And so that needs to be accounted for when planning a project. And because it is so time intensive, we tend to work with smaller groups and go really in depth and gather rich information, but this can limit the generalizability of the findings. With all that being said, though, we do believe that the strengths outweigh these challenges. The strengths include it being a powerful embodied approach that helps us to uncover really nuances in public health practice and helps us understand practices in terms of spatial and sensory details that may be missed with other research methods. It also has the power to have a positive impact on the participants themselves. Just from participating in a research study, we saw that 1 year after, there were all of these other benefits, from confidence to making change in their communities, which was really exciting to see. And finally, it allows us to have a really natural dissemination tool to facilitate public engagement and dialogue, and really using these authentic narratives from the participants to engage in dialogue with the broader public or policymakers, which we have gone on to do in other studies. Slide. We have a couple quotes from some community partners that have worked with us on these projects throughout the years that really underscore the strength of the approach. So I want to leave you with this. I really like this quote from Marnie Summer, who talks about collaborative filmmaking as being an approach that empowers adolescent girls and focuses on girls as the knowers of their own experiences, really centering the community in the process. James Russell from Sisters for Sisters Education in Nepal talked about how filmmaking can be a process that leads girls to become agents of social change. So again, not only a research method, but really leading to social change. It's really powerful in that way. Slide. So in conclusion, we want to just make this connection between collaborative filmmaking and health literacy. And we truly believe that there is power in the method in the health literacy field and kind of promoting it in the health literacy field. And so the first point that we wanted to make was that collaborative filmmaking can promote really uncovering a depth of information about complexities and nuances associated with sensitive health issues. But it can also help to promote empathy and personal experiences using narrative and storytelling, really helping to share and communicate personal experiences in a way that's beyond words alone. It can also encourage dialogue with diverse groups of people, it can allow us to have dialogue and take action with different audiences of various literacy backgrounds, which I think we've seen really directly in Nepal, people of different ages and backgrounds coming together to discuss key issues through film. And finally, it promotes engagement between stakeholders with differential power. We've seen this really directly when we've used the film to reach policymakers, both in Pittsburgh as in Nepal. Film helps really bridge that gap between people of different power differentials. So we think it's an exciting tool that we want to continue to refine. Slide, but I will leave you here with our website where you can go see more information about the various projects we've done around the world. And I would encourage you to consider using it in your work and reach out to us if you want to brainstorm and talk about ways it can be used in your work. So thank you very much for listening and for having us.
Thank you so much, ladies. You have a new podcast follower in me. So thank you. We often hear about the arts in this space associated with healing and relief, but I very much enjoyed hearing about the intersection of arts and health as an opportunity for communities to amplify their own voices, feel empowered, and be better understood by health professionals and systems committed to serving them. With that said, I am going to pass it over to Dr. Jill Sankey. She is a research director in the Center for Arts in Medicine at the University of Florida, director of National Research and Impact for the One Nation, One Project initiative, and U.S. director of the Epi Arts Lab, a National Endowment for the Arts Research Lab in partnership with the University College London. She serves on the steering committee for the World Health Organization's Healing Arts Lab and served during the COVID-19 pandemic as a senior advisor for the Center for Disease Control and Prevention. She's an affiliated faculty member in the UF School of Theater and Dance, the Fixel Institute for Neurological Diseases, and the Center for African Studies, as well as an editorial board member for the Health Promotion Practice Journal. Dr. Sankey is a dancer, a musician, a mixed methods researcher, and has 28 years of leadership in the field of arts and health. She is the recipient of numerous awards and over 350 grants for her programs and research in the arts and public health. Over to you, Dr. Jill.
Thank you so much, Fallon. It's great to be here and to hear these really wonderful presentations. I am joining you this afternoon, or just into the afternoon, from my home in New York, the land of the Lenape people, and I'm really delighted to be in this conversation. I'm going to talk about the work of the Epi Arts Lab, which Sunil introduced a little bit earlier, as did Fallon, and I'm going to dig right into sort of orienting you a bit to the lab and sharing some of our work. So we can move to the next slide, Diana. Thank you. So the EpiArts Lab, of course, is an NEA research lab at the University of Florida, and we're very pleased to partner with Dr. Daisy Fancourt at University College London, who has been a phenomenal leader in statistical research that associates arts participation with an array of health outcomes, and has been highly instrumental in leading to social prescribing, which I'm going to talk about a little bit later in my presentation. So in the EpiArts Lab, we're looking at the impact of arts and cultural engagement on population level health outcomes. And we use 7 longitudinal US cohort studies in order to undertake these epidemiological studies. Next slide, would be great. So I'm going to highlight a few of our findings, and I'm going to focus on both adolescent and young adult, sort of early development studies, and studies that focus on older adults as well. These are where we're finding particularly interesting and relevant outcomes, and outcomes that I think may be of interest to you in your work. So in a study that we did looking at child development and adolescent health, we looked at social support and loneliness specifically. We found that doing 1 or more arts-based arts activities was associated with 59% higher odds of high social support while kids are undertaking those activities. And similarly, we found that doing those sorts of activities was associated with 20% higher odds of reporting social support, high social support, a year later. And I'll mention that all of the studies that we undertake in the lab are highly controlled for the things you would think of naturally that could be related to these findings, like higher levels of education or income, socioeconomic status, geographic location, demographics, those sorts of things. And these findings do hold up across demographic and social groups. So we can go to the next slide. Similarly, we looked at substance use and abuse among young people in relation to their engagement in extracurricular arts activities and creative hobbies. And we found that young people who do engage in arts and creative activities have lower rates of substance use. And you can see what we kind of think of as a dose effect. We look at frequency and duration, and we sort of shorthand that as a dose effect, because we often see in our studies that the more people participate in arts and cultural activities, the more effect that we see. But in some of our studies, we see sweet spots, whereas, you know, sometimes more activity doesn't correlate to more significant effects. Sometimes that can change the relationship with the art form. So often we see a sweet spot of informal and leisure, you know, orientation to those arts activities. So you can see that kind of dose effect here with marijuana use and alcohol intoxication, that generally speaking, the more often young people are participating, the higher levels of impact that we're seeing. So we can go to the next slide, Diana. So we also looked at associations between arts engagement and flourishing in young adults. So we can go right to the next slide. And we found here another positive association, and you can see both adjusted and unadjusted results here. We see that again, across daily, weekly, and monthly activities, that young people who engage in arts activities are seeing higher levels of flourishing the more they're participating. And we'll break that down a little bit on the next slide into 3 different dimensions of flourishing: emotional well-being, psychological well-being, and social well-being. And we see that daily and weekly use in particular have very significant impacts on social well-being. And Sunil, I love that you started us out with that wonderful and really important Surgeon General's report that talks about the significance of loneliness and social isolation to our health and the health risk factors that have been identified in relation to loneliness. So these social support and social well-being findings, I think, are very significant for young adults. We sort of set up good health, of course, in our youth. We could go to the next slide, Diana. This is a study that that I'm actually really proud of in coming out of the lab. We looked at the relationship between arts participation and what we call reportedly antisocial and criminalized behaviors. And we saw that kids who engage more in the arts are less likely to engage in these sorts of behaviors. And we identified a couple of mechanisms in terms of how they feel about these associations and social support as well. But one of the things that I feel is important about this work that we did is that we rejected the term delinquency. We found that the literature around these types of behaviors uses this term of delinquency, which we feel as a label is highly problematic in public health. And we also recognize that many of these behaviors are not just maladaptive, but are in fact adaptive for kids who have experienced trauma and hardship. So there's a lot of dialogue in this article that I would point you to if this is an area in which you work. And we can go to the next slide, Diana. So in these findings, you can see again, if you want to drill down into these charts, you can see that more cultural engagement was associated with fewer of these activities, both in wave 1 and in wave 2. So this is across time points, but not so much in wave 3. So that what we're seeing here is that participation in arts activities can have benefits that will linger in relation to these behaviors. But after a time, if kids stop engaging in arts and cultural activities, that effect can be lost. So sustained engagement is very important here as well. Next slide, Diana. Great. And actually, I think I've talked through all this already, so we can go to the next slide. So when we look at all of these findings, and we've published, I think, 13 studies so far using these American data sets, and we've got another 7 studies that are either under review or we're getting ready to publish. What we see in all these studies is that the arts as a health intervention or a modality are uniquely multimodal when we compare them to other things like, physical therapy or other interventions that we might prescribe from the health system, in that they offer physical, cognitive, emotional, and social benefits all at the same time. So arts and cultural engagement are quite unique as arts as health interventions. We can go to the next slide, Diana. We also find in our work and are really lifting up that arts participation is a health behavior. We started our work in the Epi Arts Lab by looking at who participates in the arts in the United States, and we found, not surprisingly, that there's a big social gradient in who participates across demographic and socioeconomic groups. And we understand, and you can go to the next slide, Diana, that limited access to the arts or barriers to arts and cultural participation limits opportunities for good health. And so we believe that access to the arts is a social determinant of health. You can go to the next slide, Diana. And so in the Epi Arts Lab, we're moving to a third phase of our work. We've undertaken these statistical studies to understand some of the relationships between the arts and health outcomes. And like in the UK and about 25 other countries, the United States is now exploring social prescribing as a policy and a systems approach to providing access not only to arts and culture as health resources, but to other social resources in communities. So social prescribing is a system that exists now in 23 different countries. And so we're focusing as a policy outcome in the Epi Arts Lab on exploring the feasibility of social prescribing in the United States. So we're conducting case studies right now. We've completed 12, and we plan on completing between 23 and 25 case studies now. We're also beginning implementation science studies. So these are the if we build it, will they come studies. So we're exploring the acceptability and the feasibility of social prescribing in the United States, as well as what would the financial model be for social prescribing? What would the cross-sector collaboration look like? What would the systems look like around social prescribing in the United States? We're also working to prepare for what feels like an inevitability around social prescribing being established in the United States by creating resources that can help elevate and accelerate the quality of research that can be done so that we can inform evidence-based practice and policy and investment in social prescribing studies. So we're developing 5 core outcome sets, and core outcome sets are resources that say, hey, if you're studying things around this particular thing, try to study these things so that we can build collective statistical power for synthesizing evidence, doing systematic reviews and meta-analyses so we can really understand practice and how to make investment and develop policy. We're also developing a set of key common outcomes for social prescribing, and we're in the process of developing a social prescribing field guide for the United States right now with a focus on arts prescribing. So those resources will be coming through shortly. We can go to the next slide, Diana. So as I mentioned, social prescribing is a system wherein health providers prescribe social and arts and cultural activities, and health systems pay for them. And these are some of the countries in which social prescribing is established. We can go to the next slide, Diana, which is a model of how social prescribing works. There's one element that I want to draw your attention to here, and that's the role of the link worker. So when a prescription is made, that referral or prescription goes to a link worker who is like a community health worker or a patient navigator or a social worker. And in fact, in the United States, those roles may be the roles of the link worker. This is all being piloted in these different programs now. But the link worker is someone who understands the social and arts and cultural resources that are available in a community, talks with the patients about what their interests are and helps connect them, and then is the link to information coming back to the health system as well. We can go to the next slide, Diana. So studies, we were just finishing a scoping review of social prescribing outcomes. And we're seeing that in 13 countries where social prescribing exists, we're seeing increases in psychological well-being, quality of life, physical and mental health, reductions in anxiety, loneliness, and social isolation. And this is especially effective as an intervention for loneliness. We're seeing reductions on primary and emergency care system burden, 38% in the UK reduction on the burden in primary care, and long-term health savings are in question. There's some evidence that social prescribing is saving healthcare systems money, but it's not quite conclusive yet. We can go to the next slide, Diana. Great, and we're again seeing really tremendous outcomes here for people who are disadvantaged by social determinants of health, particularly people with chronic diseases, loneliness, high risk of mental health, or low levels of incidence of mental health already, and people who are vulnerable due to age and financial situations. So we can go to the next slide, Diana. So in my perspective, social prescribing or arts on prescription is most effective as a systems alignment approach. There remains the question whether this is going to require new funding in our healthcare systems or just systems alignment, but it is cross-sector collaboration. It's an expansion of the system of healthcare, which people think of as healthcare institutions, to the entire community, and recognizing arts and culture as available community resources and engaging those resources in building health at a community level. So social prescribing builds wellness, it addresses prevention, and hopefully it's a means for advancing health equity as well by providing hyper-local resources to people for advancing their health. And I think I have one more slide, Diana. Oh, a couple more slides. So again, social prescribing fills this gap in the healthcare system where people present to the healthcare system because it's where we go when we're not thriving, and may not yet need sort of big, high-level interventions like medicine or other high-risk or high-cost therapies, but present with things like loneliness and not thriving, and can benefit from social interventions and arts and creative interventions. And that may be alongside medical treatments, or it may be in lieu of or able to delay introduction into that pathway of riskier interventions. Next slide, Diana. Right, thank you all so much. I really appreciate your attention.
Thank you so much. All right. Now we are going to jump into the final portion of our call today. I do first, though, just want to thank everyone for such insightful presentations and the work that you have done. Now, I would like to have all of our panelists back on stage with their cameras on, if possible, so that we could start our final portion, which is the Q&A. If you have any questions for our speakers that you've yet to add into the chat, into the questions feature in Zoom, feel free to do that now. But we're going to go ahead and jump into the Q&A portion. All right. So I'm going to go ahead and look at the questions that we have. So first one that I have is for Dr. Iyengar, Mr. Iyengar. Are the grant opportunities open to only nonprofits or other organizations as well?
Thank you, Fallon. It's Mr. Iyengar, and yeah, it is actually, we're open to nonprofit or arts organizations, but also certain kinds of designated applicant organizations that you can find on our website. This includes recognized tribal entities, school districts, certainly colleges and universities, a host of others, but the majority of our funding actually goes, our direct funding goes to nonprofit organizations of any type. You notice I didn't say nonprofit arts organizations because they can be any kind of 501c3.
Thank you. The next question I have here, I believe is for Jill. Do you differentiate the benefits of physical activity involved arts versus quieter drawing, painting arts? Art activities involving social connections versus those where you can do them by yourself?
Yeah, that's a really great question. And some of our research does sort of pull apart receptive and participatory arts activities. We have a paper that's close to publication right now that found that among people over the age of 50, going to concerts, performances, museums, or galleries just once a month or more is associated with 80% higher odds of healthy aging across 2 years and about 58% higher odds across 4 years. And we looked at the sort of why in that, and that's specifically receptive activities, so going to concerts and museums. And we believe that's because of two primary things: the ability to socialize, and I think Sunil, you touched on that earlier as well, the ability to socialize when you're going to concerts or museums of galleries, and leaving your home, right? Getting out. So it's about mobility and social connection primarily. And with that age group, sometimes or often participatory activities, though they can also be social, can also be sort of solo at home and alone in a studio. So that the differentiations between the two are important. And we also find it important to remember that what we call receptive participation is not passive, right? Because you're very socially, emotionally, cognitively, and even you can be physically, engaged in that. So there are some participatory activities like dancing and theater, that also bring that physical dimension, and we see benefits there. So for different art group or age ranges and for different health outcomes, we see different benefits across that active and receptive paradigm. Or spectrum, rather. Sunil, I think you're muted. You're adding.
Oh, sorry. Just to underscore, if I may, what Jill said, I think the multimodal nature of arts participation really is key to understanding how to study it. And I know that the National Institutes of Health, for example, just released a toolkit on studying music and health interventions for, say, Alzheimer's disease and dementia. And in doing that, they were very attentive to that distinction that Jill said about receptivity, sort of not being a passive form of engagement, as well as creating art music in that case, and what that does physiologically and psychologically. So there's a lot of great research there.
All right. And I do have another question that is for the full panel, so feel free to jump in. How is culture addressed in the arts and music therapies?
I think
Not
maybe
all at once.
I was wondering if, not to pass the buck here, but it was really wonderful to see the collaborative filmmaking intervention at work and understand the cultural nuances of that. I think that's a very good question, because I think it's implying that even in the delivery of arts and cultural services, and certainly creative arts therapies, as we've called it, one has to be very cognizant of the recipient and engage them in a way that's culturally sensitive. So I wonder if, not to lob the question back to others, but I feel like some of you in the field doing this work probably have some good responses.
Thank you, Sunil. I mean, I can jump in. I appreciate that. And I definitely think using kind of these creative arts-based tools that really center the community voices really allow us to celebrate the different cultures and different ways of engaging in the arts, right? Or different ways of expressing ourselves, which can happen in different ways in different cultures, which we've started to see a little bit in our collaborative filmmaking work, in Madagascar versus Nepal, which is really exciting. So I think kind of just broadly in general, the arts allow us to really celebrate those cultural nuances. But actually the question really got me thinking about another project that Jesse and I worked on in post-earthquake Nepal, looking at kind of the role of community art in post-earthquake or post-traumatic settings, and in the role that community art can play. And one of the things that kind of got us started on this project was, after the earthquake, there were all of these kind of very interesting forms of art popping up, whether they be public murals or spoken word poetry events happening really in days after the earthquake, which to me was really, really neat to see. And it really brought people together, but we wanted to look at it more from a research perspective. And one of the things we ended up finding was the role of kind of cultural art and spiritual art was really important. So traditional noir paintings became something that a lot of people talked about as being helpful for them to kind of work through all of the different emotions that they were feeling at that time. And it wasn't something that we were necessarily expecting, but something very specific to Nepali culture that kind of bubbled up in our findings, which was really kind of neat to see the local art being celebrated in a very outward way. So I don't know if Jesse, if you wanted to add to that at all.
I think that's great. I mean, it is both, I guess one comment is for the collaborative filmmaking in particular, it is the participants who are creating it, and then it is the art and the films that are then shared for the audience, and that is a receptive, right, piece in terms of that they have created it and that it is done by the participants and those community members themselves. Thanks for the
I also just love the fact it's participatory action research, and you're engaging their voices in the creation of the intervention. That truly does draw on their own agency, which is something I think is key as we're learning in health literacy. So it's really fantastic.
Thank you so much.
Thank you. Well, that concludes our Q&A portion today. I just wanted to thank everyone for joining, and also to remind you not to forget to complete the individual session evaluations and the overall conference evaluation by visiting the IHA conference homepage. Thank you so much for joining us today. Diana, anything else you'd like to add before we close?
Nope, but we'll see you next session. Thanks, everyone.